I think one of the highlights of this meeting was the fact that before the meeting actually took place, we had 50 to 60 advocates, patient advocates, so that's patients in active treatment, caregivers, survivors, that went up to Capitol Hill and had like 70 visits, and not just with staff, but with members. In fact, during their lunch break, Representative Congresswoman Kathy McMorris-Rodgers, the fourth highest ranking member on the GOP side on the House, and Congressman Gene Green from Texas, who is the ranking member on the Energy and Commerce Health Subcommittee, and Chris Collins, who's working on this 340B bill and talked about 340B, came and addressed the group of advocates. And so I think one of the inspiring things which carries through then to the conference are the advocates, because this always has to be about patients. So whether you look at the clinical sessions, and I heard some great things even from my wife who attended, she was raving about the lung cancer session. I heard great things about Dr. Joyce O'Shaughnessy and the session on breast cancer, but that's about patient care. And even the business section and the operations section literally is about keeping practices viable and as efficiently as possible so they can deliver the highest quality care and the most efficient care. So, and of course the advocacy session is about the advocates. So I would say number one takeaway that we can never forget, that this is about patients. Unfortunately, healthcare and specifically cancer care is becoming big business. And I mean big business for large hospital corporations as well too. And so I think a takeaway is the patient perspective. I think the other takeaway is that there's a vibrancy about this conference. I guess we're going to end up with 1,300, 1,400 people, but a vibrancy that you can see just walking through the halls, because community oncology came together like never before last year. Had a big victory over the Medicare Part B model, or as experiment as I like to call it, which was really would have terrible adverse impact on patient care, not just all the financial reimbursement ramifications. So I think that in terms of the meeting, the vibrancy was about defeating that. The vibrancy was stopping CVS Caremark from stopping certain practices of getting their medications from the practice, and that's given a shot in the arm. I think there are a lot of people that are involved, a lot of practices here involved in alternative payment models, and I think that's a third highlight in terms of all the discussion around alternative payment models, the oncology care model. We have a number of most of the CMS, CMMI team that's working on the OCM, and we're talking about the OCM 2.0. Now, I mean, there was a great session on PBMs, a great session talking about legislative update, but I would look at it and summarize and say, number one, it always has to be about patients, and I think everything reverberated around the meeting was tied to patient care. And I think then when you look at it, it was the vibrancy of this meeting, the networking, the sharing of ideas, the best practices, and then I think the realization that I said it in the session that I had with Dr. Kavita Patel over the OCM and what we call the OCM 2.0. You know, the unfortunate thing is you just can't be a physician today. You shouldn't be a data entry clerk. We're trying to change that. But you should be a physician who realizes the very definition of my practice has to change. I have to think differently, as I challenge the entire meeting, think outside of the box. So, you ask, well, what does that have to do with the cancer moonshot? Well, honestly, aside from the fact I really commend former Vice President Biden for sort of launching this moonshot, but this moonshot is being fueled by community oncology. And right now, as I'm doing this interview, there's a session going on about how community oncology is really fueling the cancer moonshot with some of the leaders out there from community oncology.